Hi, I'm Jerry Hesch, Dr. Hesch from Hesch Institute in Aurora, Colorado. I'm a physical therapist, and we treat chronic pain and difficult pain syndromes such as sacroiliac joint dysfunction and coccyx joint dysfunction, and we also have an educational component in which we teach workshops and have home study on treating the whole body, and also a separate one on treating the sacroiliac joint and treating the coccyx. This is a very brief presentation on the relationship of the coccyx to the sacroiliac joint. Whenever evaluating the sacroiliac joint, one should also evaluate ligamentous tension in the long dorsal sacroiliac ligament, iliolumbar ligament, get a sense of the tension in the smaller ligaments medially, and appreciate the sacrotuberous ligament tension, and also find and evaluate tension in the sacrospinous ligament. Now, the sacrotuberous and the sacrospinous and the sacrococcygeal ligaments are important to evaluate for coccygeal dysfunction also, because those ligaments, of course, attach onto the sacrum, but also onto the coccyx. And coccyx joint, sacrococcygeal joint dysfunction, is fairly common in the population who presents with a diagnosis of sacroiliac joint dysfunction, and I think that it should always be evaluated. And one common pattern does not get a lot of press. It's not mentioned a lot in the literature or in educational videos, is a side bent coccyx, which can happen with excessive tension in the ligaments or with asymmetry of the pelvis inducing asymmetrical forces in the soft tissues and especially the ligaments. And with the side bent coccyx, the top of the coccyx, the first segment, has a transverse process, and it will move superiorly when the tip goes to the left, and therefore when you come on both sides, then the sulcus on the left would be deeper. And this is a very brief video. I just want to encourage evaluation of coccyx dysfunction for side bent coccyx, or also evaluate for a hyperflexed or hyperextended coccyx as well in a presentation of sacroiliac joint dysfunction. Thank you very much.